Have you noticed white patches in babies' mouths? This is what they are. So it is called oral thrush, caused by a fungus known as Candida albicans. Risk factors for it is when a baby is exposed to a vaginal canal of a mom that had Candida, the baby is going to pick it and they will have it. 2, when babies are using bottles and pacifiers that are not clean enough, they can harbor the fungus. Hence, the baby is going to feed on the bottle or the pacifier and they will get the oral thrush. 3 is when the baby's immune system is weak and they can't fight any fungus that comes into their body, so it is going to end up overtaking and they will get oral thrush. 4 is when either the baby or the mom is taking antibiotics. Now, what the antibiotics do, if taken for a long time, they also suppress the good bacteria in our system, so the body will not be able to fight against the fungus and the baby will get oral thrush. How we can prevent them is treating ourselves as mothers known to have Candida, so that by the time we give birth, our canal is safe for our little ones. Making sure that bottles and pacifiers are cleaned in a good way. Put them in hot water before storing them. Store them in a container that is sealed and closed. Do not use antibiotics when you do not have to, because they are not safe for you and the little one. At that time, if you've seen such signs, then you need to call a doctor and you don't have to self-medicate. So usually there is both milk residues and then these white patches, and they tend to get confusing. So how do you tell the difference? The difference between milk residue and oral thrush is when you get a clean cloth and you clean away the milk residue, it can go away. But when you get a clean cloth and just try cleaning the oral thrush away, it will remain there, it will stick there, meaning you have to call your pediatrician and ask them what is going on with your little one, and then they are medicated. Signs that you can see from that your little one has oral thrush: 1 is the oral patches themselves. 2 is when they feel a certain discomfort when they are feeding. 3 is when they get cracked lips at the end, at the corners of the lips, they can get some cracks that can also make feeding very, very uncomfortable. So don't see this and you sit home with your little one. Please go to the hospital and see a doctor. If you are a mom out there and you love mommy content, mommy conversations, parental educations, follow PragmaMom, like and subscribe.